Good afternoon, everyone. We have arrived at the end of the European Health Management Conference 2027. I see there are some people that are still coming in, so a few will continue to join. But in the meantime, I think I'd like to start with some numbers. This year I think it's a record conference. The numbers tell us that. We had 530 participants. We have 51 countries present throughout the 3 days, 492 abstracts, 62 sessions. And the first time that we accredited the conference, and I promise we will continue to do that for the future years. And the second time in Barcelona, after 20 years, 21 years. Wow, that's a lot. So we have listened to a lot of knowledge. We have listened to many different presentations. We thank you all very much for having chosen this conference to present your research, to present your work, and to learn from others about their work and how we can improve health management across Europe. And right now, we would like to recognize some of the research that we have heard. And I would like to start with the Karolinska Institutet Medical Management Center and EHMA Research Award. And for this, it is my pleasure to invite on the stage Professor Dr. Mats Brommels from the Karolinska Institutet Medical Management Center.
Thank you, Federica. Dear all, the future depends on the youth. Consequently, the best way to enhance a scientific discipline is to support early career researchers. Slightly contradictory to my opening remark, I have to say it's never too late to start a research education. On the contrary, I think that having life experience and work experience is quite important when one embarks on a scientific career. And obviously, health organizations and systems are not perfect. There is always a scope for improvement. And doing so by applying scientific methodology is probably a good recipe for success. But anyway, it felt very natural to direct the Karolinska Institutet Medical Management and EHMA Research Award to PhD candidates. We are very happy to be able to recognize and award the best PhD contribution to health management research. And EHMA is the self-evident arena to find that contribution. A few words about the process. We invited PhD candidates across Europe and from other EHMA members to submit abstracts. And in a blinded peer review process, we produced a shortlist among these submitted abstracts. This year, 4 contributions were shortlisted and invited to present their work in an oral session. I think it's fair to say that it's a rather fierce competition, which means that to be selected to the shortlist is an achievement worthy of celebration. So I urge you to check the program folder to find the names and titles of all the 4 presentations and look for them as soon as the abstract book has been published after the conference. In a competition, there unfortunately can only be one winner. And I say unfortunately because the jury found that actually all contestants this year would have been quite worthy of a prize. But in the end, after a a rather tedious process, we decided on this year's winner. The contribution addresses an important topic. It is methodologically sound, and it's based on an impressive and comprehensive dataset, tediously collected. The results are competently derived, interesting, and causal relationships are disclosed. Practical recommendations to healthcare managers are formulated, and policy implications are presented, indeed even demonstrating a political stance, which is a very brave move by a researcher. But the conclusion is easy to embrace by all of us. After all, we are only human. The winner today is Frank van den Baan from Maastricht University. Congratulations.
Thank you.
And
Thanks.
let me present you with this certificate. In early days, we were also able to hand over a check, but I guess that right. It's a so.
It's still there. Okay, that's
So you need to tell us your bank account.
okay. Yeah.
But this is the
Thank you so much.
the certificate.
Thanks. Yeah.
And we now invite you to give a shortened version of your presentation to the full audience.
Yes. I am very tall, but I'll keep this short. Yes. Thank you. Thanks so much for the award, and thanks for giving us the opportunity to share this with the whole audience. As said, I'll keep it short. This is the cover of my thesis, which was developed by my girlfriend, so also credits to her, with a little reference to my hometown, The Hague, so the beach, which this afternoon I'll also go to, but then in Barcelona. I'll take you quickly through my research. And it was Wednesday when we had the plenary where Naomi Chambers said there's going to be no return to some golden age of relative stability and calm waters. And that really struck with me because that's also the context that I focused on in my dissertation, particularly looking at hospitals and the environment that they're dealing with. Because they're dealing with shocks, so high consequence events with a major disruptive effect. And shocks, of course, are not new, but the way that they present themselves is, because we see that these days they occur more frequently, they happen over a longer period of time, and that they're increasingly overlapping. And next to shocks, we're also dealing with uncertainty, meaning that for organizations and the people working there, it's increasingly difficult to understand what is going on now and what will happen in the future, and most importantly, how to respond to that appropriately. And besides these more external challenges, we're of course also faced with workforce issues. And Thomas Zapata and colleagues estimated that in 2013 we had a shortage of around 1.6 million healthcare workers in Europe, and this will rise likely to 4.1 by 2030. And while many factors are contributing to this, we also see that decreased health and well-being of the workforce is playing an increasingly bigger role. So in light of this, my dissertation had two main research questions. So how do hospitals and staff respond to a prolonged shock, and which challenges does that create? And also, how can hospitals support staff then in such an environment? And for the sake of time, I'll skip the methods. Just know that it's a rather long time frame, and we use various methods, totaling to 2 mixed method studies, 3 qualitative studies, and 1 quantitative study. Onto the results. Of course, there's much more to tell than I can show. So yeah, also have a look at my dissertation online. But anyways, I'll focus on 3 key insights. The first, pertaining to the first key insight, what we found is that while considered unique, we actually saw that the COVID-19 pandemic actually accelerated already existing challenges, which also need to be tackled going forward. We identified 3 key main issues for healthcare managers. Mainly the increasing demand for care while also dealing with increasing staff shortages. The need for increasing collaboration between organizations while also operating in an environment that actually enforces competition. And third, the need for more inclusive leadership by healthcare management while operating in a culture where decisive leadership is still the norm. And crucially, when we look into responding to dynamic environments, we see that for hospitals to accurately respond, they depend on the commitment, well-being, and availability of staff. But this brings me to the second key insight, because while this health and well-being is so important, we also saw that it's exactly this that hospitals cannot sufficiently support so far. We, for example, saw this when we looked into the development of employee commitment over time during COVID, where we noticed that this commitment to care for patients decreased. And not because healthcare workers didn't want to care anymore, but because they were dealing with competing demands between regular and COVID care, a lack of recovery, and also they experienced a lack of support and appreciation from the organization and society as a whole. And we saw some similar dynamics when we looked into the decreasing use of psychosocial support during the crisis. So the use was rather low, even though the need for it was high. And this is because hospitals failed to account for diverse needs of staff. They had a reactive rather than a proactive approach. And there's still an organizational and professional culture where mental health is still being stigmatized and barriers are difficult to overcome. Crucially, we see that so far well-being is still considered an individual responsibility rather than an organizational one. And we see that staff absorb organization and system-level failures, which results in adverse health and well-being. And in my dissertation, we also looked into strategies that hospitals can then take. And I'll highlight two. So the first one, I'll skip this, the team leader. The first one was we looked into the role of slack, so buffers in terms of staff or resources. And we looked at what the effect of that is in terms of absenteeism and turnover of staff. And we found a curvilinear relationship between employee slack, so buffers in terms of staff, and turnover of staff. And we also found that during a shock, financial slack can significantly reduce absenteeism rates of organizations. And furthermore, we also found that if organizations move away from these efficiency or managerialism principles, such as hierarchy, accountability, or efficiency, team leaders, who play a very important role, are better able to support the frontline staff. So in total, this suggests that we should move away from efficiency-centered systems toward more human-centered systems. So what does this all mean? How can we future-proof our organizations? Again, there's much more to tell, but I'll highlight 3 action points. The first one being what I coined, the centrality of humanity. Now, with that, I mean that well-being of healthcare professionals should be an organizational responsibility rather than an individual responsibility. And most importantly, that we start seeing staff not as just resources needed for organizational performance, but as humans with individual needs that need to be addressed. Second, we need to understand that slack can constitute a key resilience mechanism, particularly relating to protecting staff. And relatedly, we need to reshape governance and finance structures to decrease the demand of care, so really start investing in prevention and getting rid of non-value-based healthcare, but also to move away from new public management principles towards more human principles. Because we need to realize that ultimately to care for the ones that care for us, we need to realize that healthcare workers, well, they're only human after all. Thank you very much.
Thank you so much. And now we continue with recognition of some of the research that have been presented here at the conference. I'd like to invite on stage the president of the European Health Management Association, Dr. Anthony Peris-Grau, who will introduce the first award.
Okay, thank you. As it has been pointed out, it's a lot of communications, a lot of experiences, a lot of quality, but only a few ones can be selected. So we are to consider first of all the EHMA Award for the best European paper to Dr. Adrià Pla from Spain. The one from his organization. Okay, so we go on. And also, we have the recognition for the best non-European paper that goes to Mrs. Ling Jing Gong. So, more money. And there is also an honorable mention to Professor Mohammad Alamedin. Yeah. We keep it shorter, even. And then we go for the EHMA Awards for the best poster. And the winner is Dr. Ahmed Khan Kushukur. This is really a fast ceremony. And as for the People's Choice for the Poster Award, this goes to Alessandra Pernice. You can keep all the others.
Thank you.
Don't worry.
Thank you. Thank you. Thank you so much.
Good luck. So now we'll proceed.
We proceed. No, keep these. That's for you.
Thank you.
What? No, sorry. I thought I've done something too fast. But we would like to announce where we're going to see each other next. Because as I said at the beginning, if that was your first time, we expect you next year. If that's your n number of time, well, we expect you next year too. So, Anthony, next year we go
We are
to...
not going that far. We're going to Bilbao. We'll be in the north of Spain, in Euskadi, collaborating with the Basque Health Department with Osakidetza. And we expect that we had as many contributions, as many participants.
More.
And highest quality is difficult because this year we've had a huge quality, not only for the participants, for the contributions, for the communications on oral or posters, or the speakers. The plenaries have been really interesting. But we've been in a beautiful, beautiful place. We are to thank a lot, Jesse, for your hosting, your collaboration. It's been splendid, really. And we are to thank also La Unión, because the three of us, La Unión, Jesse, and Emma, has contributed for the, probably so far, as for the figures you mentioned, the top of the different conferences we had. I don't know if I'm to wait a bit.
Okay.
I want to speak a bit of the future, but maybe
I will finish
now.
thanking, yes. We would also like, of course, let me reiterate, a big thanks to IESE Business School, big thanks to La Unión. We'd also like to thank the many partners that made this conference possible, and I'd like to name them. We have had Sanofi, we have had MSD, we've been the European Observatory on Health Systems and Policies, we have had the Health Lean Analytics, the Univans of Healthcare Excellence Award Program, WHO Barcelona Office for Health System Financing, the WHO Office on Quality of Care and Patient Safety, the Joint Action Heroes, and then many other partners, Euriga, IFIC, several projects where Emma and several of our members and partners are involved. To all of you, we thank you very much for having made this possible.
And just a very short closing, just to thank you everyone for being here, for having participated. As I rapidly mentioned when we started, Europe is changing, the world is changing, health services are to change. We are to integrate also with social services. Leadership is important, and we are all together to keep on this hub that EHMA plans to keep on going and maintaining. If any one of you or your organization is not yet a member of EHMA, we encourage you to do it soon. We like to be even a bigger organization. Thank you everyone for attending, and we are looking forward meeting you next year in Bilbao. See you. Thanks.